Since time has begun, there have been brain-injured children. And since time has begun, it's been believed that brain-injured children could not be made well. As a result, brain-injured children have died or sometimes been confined to institutions very like prisons of the worst sort. Our objective has been to make brain-injured children well, which was considered to be impossible. To propose that such children might be made well was considered ridiculous or even dishonest. For the last half-century, the team of child brain developmentalists here at the Institutes for the Achievement of Human Potential has been proving that a significant number of brain-injured children can get well. The Institutes is a group of nonprofit institutes founded in 1955 by Glenn Doman. The Institutes is internationally known for its work in child brain development and for its programs to help brain-injured children achieve wellness, and well children achieve excellence. Historically, children diagnosed with developmental delay, cerebral palsy, autism, Down syndrome, attention deficit disorder, hyperactivity, learning problems, dyslexia, and a host of other symptomatic diagnoses have been considered hopeless. Thousands of parents have come to the institutes to learn how to help their children at home. Those parents have proven beyond any doubt that brain-injured children are not hopeless, but instead have tremendous potential. The institutes exist to ensure that all brain-injured children have a fighting chance to be well. The objective of the institutes is to take brain-injured children, however severely hurt, and help them to achieve physical, intellectual, physiological, and social wellness. The majority of our children achieve one of these goals. Many children achieve two of these goals. Some children achieve all of these goals, and some children achieve none of these goals. What is brain injury? Brain injury is what occurs when brain cells die. When the brain is injured, the child will either have a problem with the incoming sensory pathways or the outgoing motor pathways, or both. When a child cannot see, hear, or feel properly, he cannot respond to the world around him appropriately. This may be a severe problem, as it is with a child who is functionally blind, deaf, insensate, paralyzed, and speechless. This may be a moderate problem, as it is with a child who cannot use both eyes together properly, lacks the fine-tuning to handle the common sounds in the environment, or is too sensitive or not sensitive enough to touch and may not yet be able to move or talk or use his hands at age level. This may be a mild problem, as it is with a child who cannot read, write, or do math at age level, and who may lack the balance, coordination, language, and manual competence of his peers. When the institutes began, there was no reliable evaluation procedure for hurt children. Glenn Doman developed the first reliable set of procedures to evaluate children with neurological problems. The Institute's Developmental Profile measures the growth and development of the brain. This developmental profile allows us to evaluate a child and make an exact comparison between the hurt child and his well peers. This provides an accurate rate of growth for the child and establishes a baseline against which each child can be evaluated to determine his progress. Each time a child returns to the institutes, a new developmental profile is done and a new program is created based upon that profile. When the institutes began more than half a century ago, there was no effective treatment for children with neurological problems. Instead, hurt children were often medicated, warehoused, and forgotten. Glenn Doman and his early team wanted to give every child a chance to be well, no matter how severely injured a child might be. After each child is carefully evaluated on the developmental profile, a functional diagnosis is made. A proper diagnosis describes the degree, the extent, and the location of the problem in the brain. The staff design an individual program that provides the appropriate sensory stimulation and gives the maximum motor opportunity to use the new information so gained. There are at least 3 primary ways to treat the brain. First, we can treat the brain surgically, as we do when we remove tumors or install shunts to treat hydrocephaly. We can treat the brain non-surgically. Primary ways to do this are sensory stimulation and motor opportunity, and this is the realm of the program of the institutes. We can also treat and influence the brain chemically, sometimes for better and sometimes for worse. In our air and our water, we know there are often chemicals that are bad for the brain. Lead and heavy metals of other kinds would be good examples of this. There are also medications that can be harmful or suppressive to the brain. But there are those chemicals that are good for the brain. We know when we have proper nutrition, proper liquid balance, these things provide an excellent physiological environment for the brain. 50 years ago, each child lived at the institutes and did the program there. But the staff quickly realized that parents could be taught how to do each part of the program. This permitted the child to remain at home. Children at home with mother and father made even more significant gains. Today, all our children do the program at home and return to the institutes periodically to be reevaluated and to receive a new program. The program is designed to treat the brain injury, not the symptoms of the injury. Treating the brain is effective. Treating the symptoms simply does not work. For too long, brain growth was thought to be a static and irrevocable fact. Instead, brain growth and development are a dynamic and ever-changing process. This is a process that can be stopped, as it is in profound brain injury. This is a process that can be slowed, as it is in moderate brain injury. But most significantly, this is a process that can be speeded. All that we do to speed the process is to provide visual, auditory, and tactile stimulation with increased frequency, intensity, and duration, in recognition of the orderly way in which the brain grows. We then arrange for the child to have the maximum opportunity in an ideal environment to use and develop the motor pathways. For more than half a century, the heart of the Institute's program has been based upon the fact that the brain grows by use. These are the 5 most important words in the treatment of brain-injured children. The brain grows by use. The brain grows by use. The brain grows by use. Just like the biceps, the brain literally grows by use. Scientists now recognize the plasticity of the human brain, and new research in neuroplasticity confirms that the brain is incredibly capable of recovery and rehabilitation. The old notion that once the brain is injured, there is no means of recovery has been discarded. Unfortunately, there are many ways that a good brain can get hurt. We see the child who is hurt in utero because of some injury or illness that mother may have experienced as the baby was developing, such as trauma or RH incompatibility, German measles, hydrocephaly, maybe drugs or alcohol. Sometimes mother is aware of an injury or an illness, but often problems may occur in the first 9 months which are not apparent to mother or to her physician. Hydrocephaly or oxygen deprivation would be examples of these. Sometimes an injury may occur immediately before prematurity or post-maturity, during compression of the umbilical cord, placenta previa, placenta abruptia, prolonged or precipitous or delayed delivery or a C-section, or right after the delivery, maybe respiratory distress, jaundice, seizures, cardiac arrest, or even stroke in the baby. Some children may have an illness, such as encephalitis, meningitis, Lyme disease, chickenpox, measles, or surgical complications, such as a cardiac arrest, oxygen deprivation, blood loss, or septic shock. Others may get a reaction to medication, antibiotics, vaccines, anticonvulsants, aspirin, non-steroidal anti-inflammatory agents. Other children may have a head injury from a fall, a car accident, sports concussion, near drowning, gunshot, explosions, adult illness, such as a stroke or Parkinson's disease. These all injure the brain. Some genetic problems cause injury to the brain. Trisomy 21, Engelmann syndrome, Cree-Duchat, Wolff-Hirschhorn, Miller-Dieker, Pallister-Killian, Dandy-Walker, and many other syndromes. The Institutes does not treat genetic problems, but children who have such problems are also brain injured. They have the same chance of improvement that other hurt children have. For many of these children, their neurological problems are more significant than their genetic problems. Other children may have excess fluid in the brain, hydrocephaly, a brain tumor or a blood clot, hematoma, or craniostenosis. These conditions require neurosurgical intervention. Commonly, these conditions will be handled before a child is seen at the institutes. If these conditions have not yet been discovered or diagnosed before a child comes to the institutes, such intervention will be recommended. Sometimes a child may have a progressive deterioration of the brain. The Institutes does not have a treatment program for progressive brain disease. The case of each of these children is reviewed with great care to determine if the Institutes can offer help to improve the quality of the child's life. Some children may have diseases that do not originate in the central nervous system, but instead originate in the peripheral nervous system. Spinal cord injuries, polio, muscular dystrophy. The program of the Institutes cannot help children with these problems. In the end, it matters not what may be the initial insult which begins the process of injury to the brain. The penultimate fact will be a decrease of oxygen to the brain. Oxygen is the primary food of the brain. If oxygen is cut off or decreased for any reason, the brain will suffer. When the brain is injured, there may be dozens of symptoms of that injury. This makes sense because the brain runs everything. When the brain is disorganized, this may result in symptoms which range from frightening, such as seizures, rigidity, serious illness, failure to thrive, to bizarre, such as screaming, repetitive actions, biting, smelling and tasting inappropriately, to 100 other symptoms which may seem odd, funny, or simply inexplicable. Many brain-injured children are given a diagnosis based upon these frightening or bizarre symptoms, rather than a diagnosis based upon a careful evaluation of the brain. A symptomatic diagnosis can lead to the attempt to treat the symptom while ignoring the underlying problem which resides in the brain itself. No matter how strange or hard to fathom a symptom may be, there's always a reason for that symptom. Once parents know how to evaluate their own child and they understand their child's developmental profile, many of these inexplicable symptoms make sense. When the brain is provided with appropriate stimulation and opportunity, these symptoms start to lessen or even disappear. There is nothing more important in the life of the hurt child than seeing that child get better every day. It's often said that there are no cures for brain injury, and of course, this is true. The word cure is not appropriate in the context of brain injury. For the vast majority of children, brain injury is not a progressive disease, but instead, the incident which caused the injury is over, and what is left is a good brain which has gotten hurt and needs help. Our job is to take each child, no matter how injured the brain may be, and to move that child to the highest level of function that our present knowledge of brain growth and development will permit. Profound children may be blind or deaf or insensate or paralyzed or speechless. They may have significant problems with food absorption, respiration, and even day-to-day survival. They may have all of these problems. Severe children may have serious visual, auditory, tactile, mobility, speech, or manual problems. They may have all of these problems. And moderate children may have significant problems in one or all of the sensory and motor pathways. Mild children may have reading or learning or behavior problems. They may have problems with balance or coordination. They may have problems in speech or problems with writing. And again, they may have all these problems. Most of these children will have significant health issues, ranging from failure to thrive at one end, chronic upper respiratory illness, reflux, asthma, nutritional problems, food intolerance, and allergies. The brain-injured children admitted to the Institute's program range in age from newborns to adults. No child or adult is ever refused admission to the program because of the severity of his or her brain injury. While the primary focus has been on children, the institutes actually began their work a half a century ago with adults. These early patients were primarily seniors who had strokes or younger adults with traumatic brain injury. The institutes continues to offer help to any adult who has lost abilities because of an injury to the brain. For over half a century, families have found their way to the institutes from more than 120 nations. The families of the institutes represent virtually every race, religion, and creed on earth. While there's a great diversity of background, language, and culture among our families, they have in common an extraordinary devotion to their children. Their children are the first priority in life. They are committed to doing everything in their power to help their children realize their full potential, or to restoring their adult loved ones' abilities after an injury to the brain. Brain injury is in the brain. Symptoms may be dramatic, but the problem originates in the brain. The brain grows by use. There are many ways to use the brain and thereby increase brain growth and development. A reliable evaluation and a functional diagnosis provide the start of a pathway to wellness. A program of sensory stimulation which provides visual, auditory, and tactile stimulation with increased frequency, intensity, and duration, combined with appropriate motor opportunity in mobility, in language, and in manual competence, are the basis for ensuring that a child has a fighting chance to get well. Parents are the answer, not the problem. When parents understand how the brain grows and why it grows the way it does, they are the best therapists and teachers for their children. There is no such thing as false hope. but there is false despair. Our best advice for parents of hurt kids: never, never, never give up.